Metacognitive therapy and cognitive behavioral therapy are two therapeutic approaches that can sometimes be difficult to distinguish between. This is because even though they're very different in their approach, there are also a number of similarities between the two. They both deal with our cognition just at different levels, and they're largely used to treat the same disorders. In today's video, we're going to compare the two therapeutic approaches to each other. We're going to look at both the similarities and the differences. We're also going to look at how sometimes these two approaches can complement each other to achieve the best possible treatment outcome. Let's start out by quickly outlining each of them before comparing them to each other. Let's have a look at CBT first, which is considered a cornerstone of psychotherapy. Developed in the 1960s by Aaron Beck, CBT is based on the premise that our thoughts, emotions, and behaviors are all interconnected. This means that altering a negative thought pattern can lead to changes in both our feelings and our behaviors. We can see it like a sort of domino effect, where making changes to one of these will also influence the others. CBT is based on the cognitive model, which tells us that it's our interpretations and our thoughts about the events that happen in our lives, more so than the events themselves, that determine our emotional and behavioral reactions. When looking at the application, CBT techniques are used to identify and challenge distorted cognitions, to develop new, more adaptive thinking and behavior patterns, and to learn problem-solving skills. This approach is applicable to a wide range of psychological disorders, including anxiety, depression, OCD, PTSD, and eating disorders. I have a video where I talk much more about what CBT is right here that I'll also make sure to link to in the end card if you want to know more about this approach after you've finished watching this video. Turning to MCT now, which was developed more recently by Adrian Wells. MCT shifts the focus from the contents of our thoughts to how we relate to and process our thoughts, particularly our beliefs about thinking itself. This is also why we sometimes say that MCT deals with our thinking about our thinking. MCT is based on the self-regulatory executive function model. This model suggests that psychological distress is not caused by initial thoughts about any event itself, but rather by an extended thinking process called cognitive attentional syndrome, or CAS for short. According to MCT, CAS includes worry and rumination, threat monitoring, and maladaptive coping strategies that are controlled by our underlying metacognitive beliefs about thinking. MCT is proven to be particularly effective in conditions where worry and rumination are prominent. This is conditions like generalized anxiety disorder, depression, and OCD. I do also have a short video that explains the core concept of MCT if you want to know more. And if you want an even more in-depth overview of MCT, then I have a full 10-part series that covers different concepts and techniques that are commonly used within MCT. So if you want to dive deeper into MCT, then you can find the playlist with all 10 videos from that series under the playlists on my channel. Now let's start comparing the two. CBT and MCT differ from each other in a number of ways that we'll look at in a moment, but there are also a number of similarities between the two. Let's start out by looking at the ways that CBT and MCT are similar. First up, we've got the cognitive foundation. Both CBT and MCT are grounded in cognitive psychology. They both consider that our thoughts, beliefs, and metacognitions play a crucial role in influencing our emotions and behaviors. We also see that they're both goal-oriented in their approach. Both MCT and CBT are structured in their approach, focusing on specific outcomes that are measurable and achievable within a relatively short time frame. This focus helps clients see tangible progress over the course of their therapy. We also see that both therapies require active participation from the client. This includes engaging in exercises during sessions, as well as completing homework assignments designed to practice new skills or strategies in real-world situations in between therapy sessions. CBT and MCT also both emphasize the development of coping skills and strategies that clients can use to manage and reduce symptoms of their mental health issues. Now, this is both to help clients improve their mental well-being and feel better while they're in therapy, but also very much to provide them with skills and tools that they can continue to use after they finish going to therapy. Both MCT and CBT are focused on making their clients independent from therapy, making sure that the positive changes last over time, long after they've finished going to therapy. We can actually add this on as a point of its own, as both approaches aim to empower the clients. We can say that the goal of both MCT and CBT is to make the client their own therapist over time, making sure that they can maintain good mental health through the skills that they've learned during therapy. And the final point that CBT and MCT have in common that I've chosen to include here is the importance of the therapeutic alliance. Now, this is not something that's unique to MCT and CBT, but actually something we see across all therapeutic approaches. Studies consistently show that the relationship between the client and the therapist is crucial for the outcome of the therapy. So even though MCT and CBT share all this common ground, there are also significant differences in their approach. Let's have a look at some of the key differences between CBT and MCT. The first one lies in the theoretical focus. CBT primarily targets the contents of our cognitive processes, such as the specific negative thoughts and beliefs that contribute to our psychological distress. It aims to identify, challenge, and modify these distorted cognitions to alleviate our symptoms. MCT, on the other hand, focuses on the process of thinking rather than the content of the thoughts. It emphasizes metacognitions, or thoughts about thinking, and the patterns of worry, rumination, and attentional strategies that maintain psychological distress. Another key difference is in their core concepts and techniques. CBT techniques involve cognitive restructuring to challenge and change unhelpful thoughts, behavioral experiments, exposure therapy, and skills training. This can be things like problem solving and assertiveness training. Turning to MCT now, we see techniques like attention training technique, detached mindfulness, and challenging positive and negative metacognitive beliefs. Next up, we've got their approach to treatment of thought patterns. CBT engages directly with negative thoughts, teaching clients to recognize and reframe them in a more realistic and less distressing manner. MCT encourages clients to change their relationship with the thoughts, promoting a stance of detached mindfulness and reducing the engagement with and importance of the thoughts. Next up, we've got the psychological underpinnings. So CBT is rooted in the belief that changing maladaptive thoughts can lead to changes in emotions and behaviors. It combines cognitive and behavioral techniques to address psychological issues. MCT is based on the self-regulatory executive function model, and according to that, most psychological problems are due to the style of thinking, the metacognitive beliefs and processes, rather than the contents of the thoughts themselves. Another very important difference between the two is the goal of therapy. CBT aims to provide clients with strategies to manage their thoughts and behaviors directly, reducing symptoms of mental health disorders. MCT seeks to alter the way individuals relate to their thoughts and feelings, aiming to interrupt and modify the extended thinking processes like worry and rumination. And finally, we do also see a difference in the empirical evidence available for each of them. Now, both therapies are evidence-based, but CBT has a longer history and therefore a more extensive body of research supporting its effectiveness across a wide range of psychological disorders. The evidence supporting MCT is more limited because it is a newer approach, but it has been particularly highlighted for its effectiveness in treating anxiety disorders, depression, and conditions where rumination and worry are prominent. MCT is gaining empirical support and is increasingly recognized for its unique contributions to the field. But again, because it is relatively newer than CBT, we have less evidence. This also means that CBT is still the golden standard for treatment in a lot of different disorders. So while more research is still needed to fully evaluate the effectiveness of MCT, evidence suggests that both therapeutic approaches offer valuable evidence-based options for treating mental health issues. So while CBT and MCT may seem contrasting at a glance, with one focusing on the contents of the thoughts and the other focusing on the processes of the thoughts, specifically saying to not dwell on the contents, they are in fact complementary rather than contradictory. As we've already discussed, MCT and CBT address different levels of cognition, and combining the two can provide us with a more comprehensive treatment plan. The key here is that treatment should always be individualized to the specific client's preferences and challenges. Sometimes it can be useful to apply CBT and MCT sequentially. For example, a client may benefit from CBT to gain better control over acute symptoms through direct cognitive restructuring and behavioral interventions. Subsequently, MCT could be introduced to address underlying metacognitive beliefs and extended thinking patterns, providing a deeper, more sustained therapeutic effect. Embracing MCT and CBT as complementary can provide us with a much broader therapeutic toolkit. So by embracing the complexity and the diversity of different therapeutic approaches, we can provide a more nuanced and effective care tailored to the unique needs of each client. So with everything that we've just covered, it's important to remember that choosing the right therapy depends on your individual needs and goals. If you are considering starting therapy, it can be a really good idea to discuss it with a mental health professional that can help you find the approach that suits you best. There's no one-size-fits-all, and a lot of the time it's a matter of being open-minded and and exploring different approaches and techniques until you find the one that works the best for you. I continue to upload psychological insights, tips and tools on this channel, all aimed at spreading mental health awareness and helping you improve your mental well-being. If you're not already, I'd love you to subscribe so we can meet again. Thank you for watching this one. Take care and bye for now.